You're tuned in to More Living with Jim Brogan, broadcast live from the Brogan Financial Studios at News Talk 98.7, where old-fashioned values, expert knowledge, and genuine understanding come together to give you the retirement straight talk you deserve. Jim's a former National Advisor of the Year recipient and a financial educator, and he's here today to talk about how you can live out the best years of your life. Jim and the Brogan Financial team have been helping retirees and pre-retirees across the Southeast for over 20 years in their pursuit of financial independence. You can reach them during the week at 865-862-6800. So sit back, relax, and get ready to learn, because More Living with Jim Brogan starts now.
Hello, East Tennessee. Welcome to More Living with Jim Brogan, where it's all about living the best years of your life your way. As you listen to News Talk 98.7 WOKI this morning, May is Skin Cancer Awareness Month. How should we be taking care of our skin? You know, all growing up, and I'm 54 now, but all growing up, I was always told that some sun is good for your skin and good for your body. Now, should we have any sun at all, especially on our face? It's currently estimated that 1 in 5 Americans will develop skin cancer by the age of 70. So it makes protecting our skin from the sun's rays something that absolutely should be a priority. It is the #1 cancer in the United States. And as the weather gets warmer, we want to spend more time outside, working in the yard, going for walks out on the lake. But all that sun exposure can lead to consequences, of course. Our guest today is Dr. Quyn Rahman. Dr. Rahman attended the University of Southern California School of Medicine and holds dual board certification in dermatology and dermatopathology. She's worked in private practice in Atlanta, also worked at Emory University. She enjoys seeing patients of all ages with all dermatologic conditions, and can provide rapid and accurate diagnoses of various skin conditions at Knoxville Institute of Dermatology. Hello, Dr. Rahman. Welcome to More Living. It's great to have you with us.
Hi, Mr. Brogan. Thanks for having me on your show.
It's great to have you. I guess skin's the largest organ in our body. Talk about all the different things that the skin does, and of this extremely important organ, how it serves us.
Okay, yes, you're absolutely right. The skin is the largest organ of the body, often neglected and forgotten about. We often think about our organs as being hidden inside of our deeper body cavities, but your skin is your main source of protection from infectious disease, from airborne pathogens, from the sun. So it really does serve a really vital role at maintaining our temperature every day. And it provides just the unique character that makes us ourselves. It is, like you said accurately in your first statement, that the most common cancer in the world is one form of skin cancer.
And skin cancer, did I read that there's more people detected with skin cancer than all the other cancers combined?
That's right. Yeah, that's right. Basal cell skin cancer is really common. That's what we see the most of, and it's the most common cancer of any of the cancers.
So how often should someone get a skin exam by a dermatologist?
That's a really good question. And, dermatologists are sort of advocating to have more clear recommendations on this. We would love to be able to recommend that adult patients have a skin cancer screening, by a board-certified dermatologist or a dermatology practice annually or every 2 years. That would be, ideal, but that's currently not in the recommendations as, we have for mammograms and colonoscopies. The recommendations currently are to do, a self-exam every month, which we all should be doing, and to have at least your primary care doctor take a look at your skin as you're checking in for annual exams. If you have a personal history of skin cancer or a family history of melanoma, you should absolutely be having skin exams by a dermatologist every year in adulthood.
Now, you mentioned basal cell. And of course, not all skin cancers are alike. So talk to us about the differences between the different types of skin cancer.
So there are many different types of skin cancer, but there are probably three main types that the vast majority of patients and the public are familiar with. And those are going to be basal cell skin cancer, squamous cell skin cancer, and melanoma. And they're all very different, but they all are closely related to sun exposure and other types of ultraviolet radiation. Basal cell skin cancer is by far and away the most common. It looks like a pink bump that happens usually on your face, arms, or legs, and it slowly grows. It does not spread internally, so it, probably won't cause shortening of your lifespan, but it definitely can be locally destructive and disfiguring.
Yeah, well, I was going to ask how dangerous it is. So it's more just the damage to the area where it is.
Exactly. And depending on what area, if you have a basal cell skin cancer, for example, on your nose that you neglect, it can locally invade muscle and bone, and then that could expose vital organs such as the brain to external pathogens, and which could lead to a severe infection. So they can be locally destructive and can be life-threatening for that reason.
Yeah, so that is very important. What about squamous cell?
So squamous cell skin cancer is what we think is kind of sort of the intermediate in terms of dangerous level. They certainly can be dangerous and usually are, they have the potential to be more dangerous than basal cell skin cancer. They also come from the sun, really common in sun-exposed areas. And depending on what type of squamous cell skin cancer you're dealing with, they can be, very easily treated and small, such as basal cells, or they can be, they can spread, they can metastasize to lymph nodes, to other organs, and can be very, very serious in that matter.
And then, of course, there's melanoma, which, I guess the most dangerous, right?
That's right. So there's melanoma, which, again, is also strongly linked to sun exposure, UV radiation, tanning bed use, but also carries a genetic component that can be kind of unpredictable. You can have melanoma on your scalp, on the bottom of your foot, in places that don't see as intense daily sun exposure as your face and the backs of your hands. So melanoma has other risk factors that, sun is a big one, but it's not the only one. And
so you mentioned
melanoma can spread.
You mentioned small red spots. If we're, doing self-exams regularly, what should we be looking for? Is a mole a sign that there could be a problem?
That's a great question. And that's where having your, somebody else take a look, a dermatologist take a look, is really helpful, because as we all get older, we do develop sunspots, and age spots, which are just benign, brown, tan. It can be black, can be gray. They can be rough, and they can look really atypical. But sometimes those are what we don't worry about. Those are just, acquired age spots or freckles from just age and genetics and sun and time. But in terms of what to look for basal and squamous cell skin cancer, you're really looking for usually a red spot, sometimes a brown spot that grows, changes, bleeds easily, is rough or scaly. And then with melanoma, it's the changing mole. So it's the brown spot that changes over time.
Gotcha. Yeah. So I had, about a year or so ago, I had a thing on a little red spot on my forehead, and I'd seen someone that, not a doctor, but someone that was concerned that it might be cancer, and I went and had an exam, dermatologist, and it was not, thank goodness, but I have all these spots on my arm, and it looks like they're losing their pigmentation, and so I was worried about that. Turned out it was nothing. But how does our skin pigmentation naturally change over time?
Yeah, that's a good question. You're born, just genetically with the degree of pigmentation, normal pigmentation in your skin that you're sort of supposed to have. And then with sun exposure, you certainly can enhance that pigmentation. The cells in our skin that produce pigment, they're called melanocytes. And they have the potential to produce a lot of pigment. And, if you go out into the sun and you get a suntan, you certainly can, become darker than your natural shade. And then that fades in the wintertime. As we age, we can lose pigment from sun exposure and we can gain pigment from sun exposure. And those are forms of, sun-induced age spots. And they can present as little round white spots or little round tan brown spots. And those are sort of static. So as we age, they stay there and we can cosmetically, minimize them. But
okay, so they're not dangerous or anything like that.
Yeah, they're not dangerous.
We're visiting this morning with Dr. Quyn Rahman. She is a dermatologist, and this is Skin Cancer Awareness Month. It's the most common cancer in the world. When we come back, we'll talk about some other ways to remember skin cancer and think about it on a monthly basis, as Dr. Rahman said, with monthly exams. So stay with us as we learn more about this potential deadly disease. This is More Living with Jim Brogan, right here on News Talk 98.7 WOKI.
Welcome back to News Talk 98.7's Brogan Financial Studios, where Jim Brogan is coming to you live with important news and advice to help you achieve your dream retirement. Get ready to learn and live. Here's your host, Jim Brogan.
Welcome back to More Living. Excuse me, you're listening to News Talk 98.7 WOKI. I'm your host, Jim Brogan, and this is Skin Cancer Awareness Month, and we need to really, from my vantage point, understand more about skin cancer and skin health. We're visiting with Dr. Quyn Rahman. She is with the Knoxville Institute of Dermatology. Dr. Rahman, so let's talk about sun. You mentioned sun you mentioned it several times when you were talking about the three major types of skin cancer. We all like to have, at least most of us, like to have a little bit of that sun-kissed glow on our skin. I know my wife loves me to have a little bit of sun for sure. So first off, when it comes to being out in the sun, what is safe? What is not safe? Should we always be wearing sunscreen on our faces? Talk to us about what's safe.
Oh my goodness.
Is that a loaded question?
It's a dilemma that we all have. No, you're absolutely right in asking this. I mean, the technical scientific answer is a suntan is DNA damage. So, a suntan, we all know that a sunburn is bad for us, right? We all know that that's damaging.
Did you say a suntan is DNA damage?
Yes. It's
okay.
DNA damage. So the technical answer, what, the American Academy of Dermatology wants us all to do is to never have a suntan and to obtain our vitamin D through our diet and through, oral supplementation. I don't think that's practical. I mean, I do think we have to balance living our lives. We're all going to get tanned, to a certain degree, just driving in our car and taking a walk. And so I personally don't give my patients a hard time about that. I don't think we should shame each other for that. We have to do our best to protect our skin. We should be wearing sunscreen every day on our faces, necks, ears, backs of hands, because those areas are going to get a lot of sun just as we go about our daily routines. The recommendation for sunscreen is to use it every day in those areas and to use a sunscreen that has an SPF of 50, at least, closer to 50. As you move above 50, you're not really gaining that much more protection. So look for 50. And if you're out in the sun at a ball game, at the beach, reapply your sunscreen every 2 hours. So buy what you like, reapply it.
So let's talk about, heredity. I mean, it, certainly seems like, different people sun completely differently. Is there, if somebody's real fair-skinned, do they have a greater risk for skin cancer than somebody who tans naturally and maybe has, like I have a little bit of Native American in me, a little bit of Cherokee, and I just tan real easily. Is there a difference, or do we? If you're somebody like me that tans real easily, do I have to be careful that I'm not? Do I have to? That it creates a false sense of confidence.
Yeah, that's a great question too. I mean, you're right on both questions. So we have something in dermatology called the Fitzpatrick Skin Scale, and it's a scale of 1 to 6, which sort of groups patients into you're grouped based on your degree of pigmentation. So 1 being, a redhead with no pigment and blue eyes, and 6 being, very dark brown skin with brown eyes and dark hair. And so the type 1 patient, the redhead with really no pigmentation, can't tan, always burns, is at a much higher risk for the development of all types of skin cancer than the type 6 patients with really dark skin who never burns and always tans. And so, yes, you're at a higher risk if you don't have a lot of pigmentation, but anyone can get skin cancer. And so I do think there is a false sense of security when you have the ability to tan and thinking that you're spared, because you're not.
Ouch. You came right at me there, Dr. Rahman, with that one. So, but here's the thing. It's kind of funny because I don't like to just sit in the sun. If I'm in the sun, I want to be doing something. I want to be taking a walk, playing tennis, in the swimming pool or out on the lake, riding in a boat. I don't like to just sit there. So I actually don't like to sit and just get sun all day. But I went to see a dermatologist when I went in about a year ago. I was telling you for that exam. The dermatologist told me, she said she'd rather me not get any sun, and I told her about my my genes and all that. But I had a really good suntan, but I had not actually been in the sun that much. But I still probably, for those of us that tan easily or have darker skin, I guess we still have to be very careful we don't get that false sense of confidence. Or if somebody that's ethnic probably has to be careful too, right?
Absolutely. I mean, patients if you have ethnically darker skin, our African American patients, our Latin patients, we still have to reapply our sunscreen, but there are different forms of skin cancer, particularly a form of melanoma, that happens, in patients who ethnically have skin of color more commonly than any other patient population. And it's a type of melanoma that happens on the foot, on the bottom of the foot. And so, I tell patients all the time, part of our skin cancer screening appointments is to look at the bottoms of the feet and in between the toes. And they're always surprised, like, you can get skin cancer on your feet. And I tell them, Bob Marley died of a melanoma on his foot. So absolutely, we have to protect ourselves and examine ourselves. It's really important.
Now, what about tanning beds as opposed to being out in the sun? Are they equally bad, or tanning beds worse than being in the sun?
Tanning beds are worse because it is such a strong concentration of both UVA and UVB. It's not equivalent to what we're getting for 10 minutes between 10 and 2 when we're outside in the sun. 10 minutes in a tanning bed is, 1,000 times stronger than 10 minutes of natural sun when you're just standing outside. And also, patients are regular users of tanning beds when they use tanning beds usually. And so you're getting sort of that repeat, consistent, strong exposure. So we have many studies that show that tanning beds really contribute to the development of squamous, basal, and cell skin cancers and melanoma. So we should really try to use self-tanners, spray tans, things like that, instead of the actual tanning bed.
We've all had sunburns, especially as kids. I know in the last 10 years, the number of new invasive melanoma cases diagnosed annually increased by over 30%. And on average, my understanding, Dr. Rahman, is a person's risk for melanoma doubles if they have had more than 5 sunburns. And talk to us about that and how dangerous melanoma can be and what we should be looking for. You mentioned brown spots, but talk to us a little bit more about melanoma.
Yeah, so melanoma, has been has had its moment in the past couple of decades. You know, a lot of what we know about melanoma prevention has come from a pretty interesting group of patients. So there are a ton of studies that came out of Australia. You know, that's a very unique patient population. So fair skin, but basically on the equator, so a ton of sun. And if you're ever lucky enough to visit, you'll see, you know, everyone walks around with hats, rash guards, meaning those long sleeve sun shirts that the kids wear and adults as well. And there are these really cool, you know, playground shaded, you know, structures everywhere. So they do a really good job at protecting themselves from the sun. So melanoma, a lot of our melanoma studies came from that population. So we know in terms of minimizing your melanoma risk, it's really, really, really sun protection. So that's key. Most people, I think, don't realize that 70% of melanomas occur as a new brown spot on your skin. You know, most people, I think that it's a mole that you've had your whole life that has all of a sudden changed and turned into melanoma. That's the 30% chance. So 30% of the time, melanoma develops within a mole that you've had. But 70% of the time, it's that new brown spot that you've never had in adulthood. So
yeah, which
that's
we can
one thing
definitely
to look out for.
Yeah, we can really keep an eye out for that. You mentioned Australia. It's kind of interesting. My daughter is living in New Zealand. And she's 23. She's almost 24. And we've been to see her twice now. She's been there about a year. She actually has moved there for about a year. The intensity of the sun. I've been to places near the equator in the northern hemisphere, but I've never been to the southern hemisphere. And then I was told there's like not a hole in the, kind of like almost a hole in the ozone layer there. I could not believe how intense the sun was. Like it wasn't as hot as it is here in East Tennessee in the summer, but the intensity of the sun was unbelievable. Are there some areas of the world? I didn't know that they had a hole in their ozone layer.
Yeah, I'm not sure about that, but I think, you know, if you think about what, you know, we talked about the Fitzpatrick skin scale. If you think about other areas of the world that are close to the equator, a lot of times the population there has a darker natural pigmentation level to their skin. And so they're already inherently a lot more protected because of that. And New Zealand and Australia gives us a unique perspective in that the natural pigmentation level is so light and the sun is so intense. You really can see what the sun does to your skin without natural melanin protection.
We're visiting with Dr. Quyn Rahman this morning. It is Skin Cancer Awareness Month. When we come back, we'll have more with Dr. Rahman on skin care and skin treatment. So stay with us. This is More Living with Jim Brogan on News Talk 98.7 WOKI.
Welcome back to News Talk 98.7's Brogan Financial Studios, where Jim Brogan is coming to you live with important news and advice to help you achieve your dream retirement. Get ready to learn and live. Here's your host, Jim Brogan.
Welcome back. This is More Living with Jim Brogan, where it's all about living the best years of your life your way. Here on News Talk 98.7 WOKI. We're with you every Saturday from 9 to 10 a.m. and again from 3 to 4 p.m. You can also podcast us at Apple Podcast or Spotify, and you can download our podcast from our website. You can go to broganfinancial.com and click on radio. We'll have this show up Tuesday afternoon, as we do all of our shows. We're visiting with Dr. Quyn Rahman. She is a dermatologist at Knoxville Institute of Dermatology. And Dr. Rahman, you know, acronyms or catchy phrases are a great way to remember things. For skin cancer awareness, especially melanoma, the American Academy of Dermatology recommends practicing the ABCDEs of melanoma. What are the ABCDEs?
Okay, so the ABCDs are a way for most of us to be able to look at our moles and see if some of them are irregular. And ABCDE stands for asymmetry for A. So moles should be nice and symmetrical. If you took, one and cut it in half, it should be a mirror image of itself. So even sometimes moles have like a dark spot in the middle, but it still can be symmetrical. So A, asymmetry is bad. B, borders. There should be a very obvious start and stop to your mole. The border should be crisp, not hazy, and not jagged. Nice and smooth and crisp borders. C, color. The color should sort of blend in with your other moles. There shouldn't be one that is black when all of your other ones are, light brown, one that's pink when all of your other ones are dark brown. And then within itself, the color should be even. So it can be speckled, but it should be speckled throughout. The color should not be asymmetrical.
Okay.
And then D, for diameter, a good sort of reference is the diameter of a pencil eraser, which is about 6 millimeters. So your mole, if you acquired the mole in adulthood, it should not be larger than 6 millimeters. If it's a childhood mole, it doesn't follow that rule. So that's kind of tricky. And then E, finally, is for evolution. Moles should not change.
That's remarkable. I've never heard that, the ABCDEs. That's a real catchy way to remember all that. That's great information for even self-exams. Mm-hmm. What is the you mentioned sunscreen. First off, is the best way to prevent skin damage to limit exposure to the sun? I mean, it seems like it would be, right?
That's right.
So is all skin sunscreen, you mentioned SPF near 50. Are the various sunscreens, are they created equally?
So no, they're not. We have two broad categories for sunscreens. The SPF stands for sun protection factor, and that's just an easy way for us to look at a number and know, okay, this is good or this is bad. So definitely shoot for the 50. And then under the SPF, there are ingredients of sunscreens, and we basically have two large categories. We have chemical blockers and physical blockers. And so if you look at the ingredients on a sunscreen and you see only zinc or titanium or both, that's considered a physical blocker. Those are the sunscreens that sort of go on really thickly and they're hard to wash off and they kind of leave a white residue on your skin, almost like we think of old lifeguards with the thick zinc paste on their nose. So those are great because those sunscreens really do stay on and it's hard to get them to wash off in the water and you don't sweat them off as easily. But some patients don't like them just because, they leave sort of that white residue and they're harder to wash off. So then chemical blockers were created, which if you look at the ingredient list, it may say something like oxybenzone or actobenzene. It has a long name. And those are very cosmetically elegant. So you rub them on and they sort of disappear into your skin. They don't have like a metallic odor to them. So people will use them more, but you really have to remember to reapply those because they tend to wash off a little bit more easily with sweat and swimming pool and things like that. But it doesn't really matter what you use as long as you use what you like and you reapply it and you're consistent with using it.
Now, what about, we all love convenience. We're a society that is just built around convenience. What about a continuous spray sunscreen versus an actual lotion that you have to put on rub in? Is there a difference? I guess they would be. I guess they'd be chemical blockers, right? If you're looking to rub them in and not be the physical blocker, is the continuous spray as effective?
That's a good question. I mean, they are effective when used again like a chemical blocker. So you have to apply it everywhere in enough concentration, and you have to reapply it. But the big thing with the aerosolized sprays is inhalation. And so it can be dangerous to inhale those small particles for your lungs. So we really, if we are going to use those, we need to be covering our noses. We need to make sure we're in a ventilated space. Those have gotten some negative feedback, both from the Academy of Dermatology and just, other organizations for the potential risk of inhalation. So we tend
Well, I
to
know
not recommend those.
It's kind of funny because I've just never wanted somebody to rub lotion on me. It's kind of weird because I've been married for 30 years, but I never asked my wife to rub lotion on me, and she very rarely asks me. So we get in the habit of these continuous sprays, but I've always kind of wondered, are they really as effective? So I guess it's the way we apply it and being very, very careful we don't inhale any of those particles.
That's exactly right. That's exactly right.
Talk about how our skin changes as we get older and as we age, what normal looks like.
So from a pigmentation perspective, I think you mentioned it earlier, and I thought that's very astute. I mean, the skin becomes more freckly with age, and those are not necessarily dangerous spots, but we definitely become, we have more age spots and freckles as we age. And then the biggest thing with the skin as we age is just losing laxity, which doesn't have a lot to do with the skin cancer discussion, but it's just you lose volume and the skin becomes crepey, it bruises more easily, especially on the forearms. From a skin cancer discussion point, as we age, we have accumulated over our lives more sun. And so skin cancer, the risk of skin cancer is much greater at the age of 60 and 70 than it is at the age of 16, just because you haven't accumulated as much DNA damage to your cells from the sun as you do when you're older.
I know my skin tends to be dry. What should we be doing for just daily skin care? I mean, we've talked about the sun and sunscreen and all that, but what about just daily skin care? What should a man be doing? Because us men don't think about that much.
Yes, I mean, sunscreen is the biggest one, just, from the skin cancer prevention aspect. But in terms of general skincare, I mean, moisturization is great. You should definitely be using, a moisturizer after your shower every day. And you could do something thinner like a lotion, which is water-based, or if you have a tendency toward dry skin, you may need a thicker-based moisturizer, such as a cream, which usually comes in a jar instead of a pump. And those are oil-based. So they sort of create a barrier in between your skin and the cream that traps water. And so creams are more moisturizing than lotions. And an easy way to remember that is look for a jar and look for it to say cream on the jar. And you can find those at any drugstore, any pharmacy over the counter will have really good moisturizing creams.
Yeah, and a lot of them, the same manufacturer make both, right? You'll have a pump lotion and then you'll have a jarred cream.
Exactly. You may want to use the lotion on your face and the cream on your body.
Gotcha.
But do that every day. And everything else is really just, you can use any cleanser that you like. I mean, we tend to recommend products such as Dove, and not Dial, things that are a little bit more moisturizing. You don't really need an antibacterial soap for your skin if you're not dealing with any infection or prone to infection type skin. Just a regular moisturizing cleanser and a good moisturizer after you shower with your sunscreen every day is enough.
May is Skin Cancer Awareness Month. We're visiting with Dr. Quyn Rahman. She's with Knoxville Institute of Dermatology. Dr. Rahman, is there a way to treat brown spots and age spots that actually works?
Yes, creams don't always work. That's what patients always want, a lightening cream. And lightening creams can work for some pigmentation disorders, but for the run-of-the-mill, brown age spot that we acquire when we're older, that's benign, that cosmetically patients don't like, it's usually a procedural method of removal. So either lightly destroying them with, our liquid nitrogen canister or lasering them off. But I think the misperception is that you can just have a prescribed lightening cream and it's just going to make it fade away. And that in reality usually does not work.
There's been a trend, Dr. Rahman, over the last few years where people are encouraged, they drink collagen powder. They want to improve skin health, namely other health benefits, but namely reducing wrinkles and dryness. Do collagen supplements really work? And what do if they do, what should we look for in a good collagen supplement?
That's a really good question. The studies are still out on collagen supplementation. Our most recent studies basically show that, people are taking collagen to rebuild and rejuvenate their innate or inherent collagen that eventually, dissipates as we age. And our studies basically show that in vitro, meaning in the laboratory, in the test tube, collagen supplementation does work on a microscopic level to rebuild your natural collagen. The problem is the in vivo results have not really panned out for the degree of work and cost that patients are putting into collagen supplementation. So when you think about how much collagen you have to take, you're taking it every day, what that costs. If you look at patients who have done that over a year or two, the studies have not shown a significant difference between that patient and the person who has not done it when you're looking at them in photos. If you take samples of their skin, you may see a significant difference in their collagen thickness, but it doesn't always translate into what we see in real life. So because of that, it hasn't really reached a level where we broadly recommend that everyone does that. It has not been proven to be dangerous, though, which is very good.
Well, that's interesting because they become so popular. I really thought you were going to say, I thought there was a chance you may say the jury's still out on it, but it sounds like the jury right now is leaning towards it doesn't really help for the cost that it's not probably worth it. I mean, is that accurate?
Yeah, I think I would lump it into most of the other really popular cosmetic marketing, advances that have been made over the past 10 years, and that it's sort of in the category of like, yeah, if you're really motivated and you want to do, quote unquote, all you can do, it's safe and you can go for it, but it's not probably going to give you as significant results as other procedural things that we have for anti-aging.
Dr. Rahman, since the dawn of time, we've all been trying to find the fountain of youth, right? In modern day, today, we have things like fillers and toxins that can help give the appearance of youth by filling in sagging areas and smoothing fine lines. What are the long-term effects of putting these fillers and toxins in our bodies?
That's a great question. I mean, these have been around for a long time, and they've been proven really safe. Especially the botulinum toxin, it's a low dose relatively. No one's ever died of it. It's never, ever had lethal complications in terms of, for cosmetic use, and it's used FDA approved for cosmetic use as well as for many other indications such as migraines. Same thing with filler. It's a gel that you're just, injecting into the skin to replace the volume loss that happens over time. Now, there are complications that can happen if the injection is not placed in the correct location, and that's sort of the concern with filler. But in terms of safety of the product, it's been proven safe.
We're about out of time, Dr. Rahman. Can you give us your top 4 or 5 skincare tips?
Yes. So sunscreen. So sunscreen, rash guards. I think self-exams, being vigilant about having someone look and having yourself look. Be your best advocate. If you see something that's not right or that's changing, even if it's small, come and see a dermatologist.
Now, when you say rash guards, you're talking about, the long sleeve shirts that are made for summer.
Yes, wide brim hat, rash guard. That's exactly right. Sun shirts.
Okay, this has been just absolutely tremendous information. It's Dr. Quyn Rahman. Thank you so much for taking time out of your schedule. Talk to us about how people can get hold of you at Knoxville Institute of Dermatology.
Well, thanks, Mr. Brogan, so much for having me. This was so fun on a Saturday morning. So our office is right in Bearden, right on top of the hill. So stop by, or you can give us a call at 865-450-9361, and we'd love to see you as a patient.
Great. Knoxville Institute of Dermatology. Do you have a website as well?
We do. It's knoxvilledermatology.com.
Okay, knoxvilledermatology.com. Well, this has been great. I've learned so much today. Again, Dr. Quyn Rahman, Knoxville Institute of Dermatology. Thank you so much for taking time out of your busy schedule.
Thanks, Mr. Brogan. Talk to you soon. Bye-bye.
Great to talk to you. That was great information. I particularly love the ABCDEs of skin, especially melanoma. That was great information. When we come back, I'm going to have our dollars and cents tip. 4 tips if you want to be able to retire early and be successful with it. So stay with us. This is More Living with Jim Brogan right here on News Talk 98.7 WOKI.
Welcome back to News Talk 98.7's Brogan Financial Studios, where Jim Brogan is coming to you live with important news and advice to help you achieve your dream retirement. Get ready to learn and live. Here's your host, Jim Brogan.
Welcome back. This is More Living here on News Talk 98.7 WOKI. You can catch us every Saturday from 9 to 10 a.m. and again from 3 to 4 p.m. I thought that was absolutely incredibly educational and valuable, our visit with Dr. Quyn Rahman from Knoxville Institute of Dermatology. As this is Skin Cancer Awareness Month. So if you've missed part of that, we'll have it up podcast on our website. And you can also get it at Apple Podcasts or Spotify around Tuesday afternoons, typically when that comes out. It is time now for Dollars and Cents.
Want to be sure you are getting the most out of your retirement? For all the years of your retirement? That's the primary goal of More Living with Jim Brogan and our Dollars and Cents segment, where we provide you with an important financial tip that will help positively impact the quality of your life in retirement. And now, here's Jim with this week's Dollars and Cents tip.
Do you want to retire early? I think a lot of us do. You know, a recent survey from Corebridge Financial showed that 1 out of every 8 working Americans plan to stop working before they turn 61 years old. So by the time they're 60. And at the same time, most employees say they want to live until they are 100. So if you look at the easy math on that, there are a substantial number of Americans that plan to live in retirement for close to 40 years. For many of us, that's more than we actually spend working. That also presents some financial challenges, and longevity of life by itself produces challenges, because most people, if you retire at 65, most people when they retire, you're probably going to live for 25 to 30 years, especially a married couple if you look at how long till the second spouse dies. The reality is the financial risks that come with living long lives in retirement start to compound. Things like inflationary risk. What's it going to cost for things 30 years from now or even 20 years from now? We look at inflation right now. I call it the silent killer of retirement income because it sneaks up on you, and before you know it, you're like, where's my income? And then of course, market loss. We're subject to more big market downturns. The medical risks, healthcare catastrophe become much greater. So here's 4 quick tips for retiring early. Number 1, you need to control your spending. And you need to know your spending. That's actually even more important than controlling your spending. You've simply got to know what it takes for you to live. Now, there's an easy way to do that. Just look and see how much is actually hitting your bank account from work, because that certainly is not your salary. And then over the course of 12 months, is your bank account balance growing or getting smaller? Tip number 2, plan your Social Security election, because with people living longer and longer lives, it makes Social Security election even more important. Number 3, save 20% of your salary. If you're currently saving 10%, it may mean that when you get a raise, all that raise needs to go into savings. But if you really want to get ahead financially and save enough money to retire early, save 20% of your paycheck. And then finally, tax diversification. We think about investment diversification. Tax diversification is having different pots of money that you can pull income from with different tax impact, whether it's an IRA, a Roth, or a non-IRA account. Thanks for tuning in this week. We discuss cancer because greater health provides for more living so you can live the best years of your life your way. Have a great week. This is More Living on News Talk 98.7 WOKI.
The views expressed by Jim Brogan and his guests are not that of Cumulus Media. Any discussion of financial, legal, and tax planning strategies is not intended to be individualized advice and is general in nature. Always consult with your advisor for advice specific to your needs. This program's content does not represent a recommendation of any particular security, strategy, or investment by Jim Brogan or Brogan Financial Incorporated.